Okay, so welcome everybody for our webinar. So today we are going to talk about caregiving and caregivers and what they are actually going through. And so we are here together. So I'm Samantha, I'm the network director of ALAN. ALAN is Acute Leukemia Advocates Network. And I will be talking about data that we have generated through our international survey. And Stacy from Leukemia Lymphoma Society is going to talk about all kind of support that LLS is providing to carers. And we are also very honored to be joined by Marine and Gretchen, who are two caregivers and who are going to talk about their experience about caring for someone with leukemia. If you do have questions, there's a chat function or there's a Q&A function that we are going to monitor. So please type in your questions and we will address those or during the presentation if they make sense, or at the end if that can wait until the end of our presentations. And in case also you don't need to take notes, the recording and presentation will be made available after the webinar. So this is our agenda for today. So as I said, first is going to be a bit of a dry topic because it's going to be data only. So it can be a bit boring for some people. And then going into more maybe concrete example of support by a patient organization, but also then experiences as caregivers. So evidence-based advocacy. So for people who are not familiar with the term evidence-based advocacy is simply talking about something because we think it's the right thing is not what we would say evidence-based. So we need to actually generate some data in a proper way to make sure then the data actually reflect what people are really thinking. So we have been conducting in 2022 the first ever leukemia experience survey, and the respondents were carers. So it was actually the first global survey ever run, but it was also the first leukemia survey run in carers. And it was done in collaboration with 3 networks, so ALAN, which is the Acute Leukemia network, and then our colleagues from CML Advocates Network and CLL Advocates Network. So again, it was a leukemia survey. And as you can see, we had quite a lot of responses, 571 carers who responded to the survey. The survey was pretty long because we needed to cover various topics from diagnostic to care, treatment, preferences, quality of life. So really, really understand what's the carer journey. And we did translate the survey in different languages, although we have noticed that we have observed some limitation. And the first one was the recruitment was done online only. So the survey was accessible only via online, which was a limitation because some people do not like online stuff. And also the fact that it was not translated in all the languages in the world also was a clear limitation. And probably another limitation that we have seen is that we as patient organization have been talking about the survey, but that was kind of the only channels where the survey was published. So that's also probably another limitation that we could have observed. I'm just trying not to make any mess. So we have, so as I said, 571 respondents to the survey. Quite interestingly, 72% of the respondents were females, and it is quite in line with what we see from other studies that we are conducting. Usually we have a lot male representation in the work that we are doing. And we did get data from 48 countries, which is quite a lot. The age, so 25% of the respondents were 55, 64 years. And when we asked the questions what people were doing, 35% were still employed full-time at the time of the survey, 23% retired. And interestingly as well, like more than half of the people responding having average income in their country. We also asked questions as to the relationship to the patient, and so 57 responded they were actually living with they were linked to the patient, being a husband or a wife or a partner, and almost 90% were actually living with the patient. And we have also see that they do provide a lot of different support to the patient related to the treatment or relating to everyday activities. So as you can see, 90% are providing emotional support. I guess it's not really a big surprise to anyone. Or going to hospital appointment, providing transportation, collecting prescription, also doing the cooking, cleaning, shopping, also bringing the patient to appointments, but not related to the disease, and also providing transport for everyday activities. What we did not manage to assess, because it was really a lot of variation in the answers, was how many hours per week the carers was estimating that the fact that he or she was a caregiver was spent for the patient. We have not being able to assess that. So maybe in the next iteration, we will be able to see these kind of numbers. When it comes to the diagnosis, very interestingly, 86% of the carers did not know that the symptoms experienced by the patient could be signs and symptoms of leukemia, which is also telling us another story. It also means that we as patient organizations should continue or start doing more awareness on leukemia symptoms. People thought that the way they were told about the diagnosis was done sensitively, but majority of the carers did not understand the explanation about the diagnosis. So what was leukemia, or what's going to happen, or what could be the potential treatment option, etc., etc. So we could see that 81% of the people actually had to use internet to find out more information. And almost half of them thought that they were not involved as much as they wanted in the decisions around the patient treatment and care. And the numbers as well are not, I would say, very surprising, but still a bit concerning, I would say. And also, vast majority of people wanted to know what could be the prognosis for the patient, but only half of the carers actually got that information. So yeah, to me, it's a bit concerning that this kind of information is not provided for the carer. Regarding the treatment and care, so again, we had a lot of questions in the questionnaire, so I really tried to extract what was really relevant. So at the start of the treatment, people felt a bit frightened and anxious. It was kind of a mixed feeling. Relieved that they could actually start the treatment, but super anxious about what's going to happen next. And for CLL people, so chronic lymphoblastic leukemia, there's this watch and wait, which is also called active monitoring. and which means you don't put the patient straight away on treatment. You monitor the patient for a while, and then you put him on treatment if needed. And it seems that kind of half of the people actually did not really understand why you would do something like that, why there's a treatment, where there are treatment available. And almost 2/3 of the people were actually quite anxious about this active monitoring. The clinical trials are not discussed in most of the patient care with most of the carers as well. Before the patients who have been involved in clinical trials, the carers report that they have been involved in the decision, and they are also quite positive about those options of clinical trials. I would say the majority of patients, but it's almost everyone, reported side effects being impacting the patients. And as you can see, the numbers with high impact in half of the respondents. And obviously we see different numbers, chronic leukemias versus acute leukemia, which is also pretty logical. And very a lot of impact, and even intolerable in 11% of the carers. But what is pretty interesting is also, and I didn't put that here, but is that the carers actually report that the side effects have a larger impact compared to what the patients are actually reporting for themselves. So the carers tend to think that the impact of side effects is more important than actually what the patient think, which is also quite interesting. And in any case, people felt very positive about the healthcare team and the way the side effects were actually managed. And also, because as you know, there's a lot of lab tests and monitoring that you have to do for leukemia, and majority and half of them actually thought that everything was pretty well explained to them. So that's very positive. We could also see that there's, of course, impact on quality of life. So more than half of the carers actually reported that leukemia has a negative impact on their own well-being. And they also tend to report a greater negative impact on their own well-being compared to what the patients are actually reporting, which is also very interesting. There's a lot of fears and worry about relapse, for future health, waiting for the monitoring results. And also here, very interesting, they report being more worried than the patient themselves. So it seems that the emotional impact of leukemia is actually greater in carers than in the patient themselves. There's, of course, impact on work, the fact that you need to care and bring someone to the hospital. For some people, they had to actually stop working or reduce their working hours, and also impact on finances. So we could assess the negative impact, and it's reported by almost half of the respondents. We could not understand how much negative, in the sense that we did not really get the figures on what it means concretely, increased cost and income reduced, even in terms of percentage. So that would be also interesting to know in the next survey if we manage to get those numbers. And when it comes to information, so a lot of people had to actually go on internet to find out different information when it comes to treatment options, what could be the clinical trials, information on watch and wait and monitoring, on the side effects, and the financial, emotional, general well-being, patient rights, end-of-life care. So again, this is a very high number, and it also shows that people don't get that information from the healthcare team, or mainly from the healthcare team. And it's pretty concerning as well that when they are in hospital, they cannot access this kind of information. And also what is reported and what is very positive for the work that we are doing is that when people actually come across the work we are doing and the website and the information that we provide, 74% said that they found it useful and good for them. We also ask questions on, so hypothetical questions on what could be, what do you consider important for new treatment? So again, hypothetical scenarios. And what they think as carers is important is to find treatments which improve quality of life, which improve survival, bring remission, response, also better, not better, but less side effects, or at least more tolerable side effects, improve the lab result, the test, reduce the post effect of treatment, and that's especially for younger patients who have impact on fertility, and the certainty of the availability of treatments. And very surprisingly, they did not really report that a reduced impact on their own well-being, on their own family, or on their own person is so important, which is also very surprising. You would tend to think if you are emotionally impacted, if your well-being is impacted, then you would like to have a treatment which is less impactful for yourself. But actually, it's not what they put as priority for treatment for patients. And so, conclusion, it's a very heavy slide after, again, a lot of data. So we know, and we, to our knowledge, is the first international study that was conducting to try to capture the experience and the perception on the quality of life of leukemia carers. But the findings are quite in line with what we see from other therapeutic areas of a disease. And it also shows the psychological challenge, physical and emotional challenge for carers. We also can see that we need a greater involvement of carers in the treatment decisions, and really make sure that they are included from A to Z in the patient journey. And also the data show us as patient organization where we should keep doing the work or initiate the work. So as mentioned, for example, awareness on leukemia symptoms, the provision of information, and also bring more awareness also on the physical and psychosocial needs of the carers. And just before I conclude, so we are running the survey again. So if not already, you can complete the survey. It's online. You can find the information on our website, on our social media channels. You also have the QR code here that you can scan. And yeah, so thank you very much. And I will pass on to Stacy now.
Thank you. Okay, let's see if I can advance the slides.
Yeah, I'll let you.
It's not letting me.
Okay, I will do it.
Okay.
No problem.
All right, so thank you. I'm Stacy Kolzar. I am a senior information specialist for the Leukemia and Lymphoma Society. I work in our Information Resource Center. And so information specialists are here to answer questions about disease and treatment information, support resources. We're happy to do one-on-one conversations to help you figure out what information you're looking for, what support and resources might be out there for you. So I always have to start with the mission of Leukemia and Lymphoma Society is to cure leukemia, lymphoma, Hodgkin's disease, and myeloma, and improve the quality of life for patients and families. We fund research to advance life-saving treatments. We drive advocacy for policies that protect patients' access to life-saving treatment, and we provide patients and families with hope, guidance, education, and support. All right, next. So what is the caregiver role? We've talked, so some of these slides I'm going to go pretty quickly because Samantha went over a lot of this data from the care survey, but I wanted to touch base on a few things and just the caregiver role can vary, right? So you're assisting a loved one, and it can be occasional, it can be more consistent. Um, and the support needed for each caregiver may be a little bit different and it may change over time. No one family mirrors the other, so there can be similarities. So there's no set caregiver structure per se. We certainly learned that most caregivers or many caregivers are spouses or partners, but we also know that they can be friends and other family members and adult children. From the survey, we also learned that most caregivers live with the patient, which means most of them are 24/7 caregivers. It's all the time. Next. So what does a caregiver do? And Samantha also already kind of went over this data. And the better question is, what does a caregiver not do? The caregiver seems to do everything, right? Day-to-day, daily living tasks, grocery shopping and meals, managing healthcare. Many caregivers say they feel like they've turned into a nurse like overnight because they're having to figure out how to give medications and schedule all these appointments and look for side effects. So there's a lot, I think, of pressure put on the carers to try to help make sure that their loved one is getting good care and communicating well with their treatment team. And then providing emotional support, which again, no one is surprised by that. Next. So unique stressors that are associated with the caregiver role. Um, there's so much stuff on this slide, and I apologize for the small print, but really, you all know the stress that you're under, right? Like none of this looks surprising to anyone, but I wanted to list some of it here because I feel like sometimes when you're a caregiver, you feel alone and you don't feel like there are other people doing or feeling the same way, or you shouldn't feel that way, or you shouldn't be this stressed. And so just putting up the emotional stressors, the physical demands, um, financial burden, and trying to work on top of all of it. I just wanted to put it up there so that you can see, and you saw from the data, most caregivers go through these things and they struggle with these things. So you're not alone. It is very normal to have these kinds of stressors and issues being a caregiver. I think so much gets put on the patient, like everyone worries about the patient, but I think sometimes people forget to worry about the caregiver too. Next. Okay, so let's get to the ways that we can cope and some of the supports and resources. So this one gets a little tricky because it is an international program and each country has its own supports and resources. Um, so we'll try to cover a few different things here, but ways to cope, seek social support, right? Like our village is so important to us. And so whether that's finding support resources from organizations, whether it's talking to family and friends, whether it's using your professionals and healthcare professionals, like in the hospital systems, figure out where those supports are for you and utilize them. You know, some family members will jump in and do anything and everything, and others won't really do anything unless they're asked. But I think the important part is to don't be afraid to ask for help. There are people out there who want to help. Most people have family and friends who would like to help. But you have to ask because they don't necessarily know what you need unless you ask. And I think most caregivers, I think, try to just take care of everything themselves and forget to just ask for help sometimes when they need it. Next. Other supports that are out there, join a support group. So for some people, just being in a room or on a screen or on the phone with other people in similar situations just provides a different aspect of your village. It's people who really know what you're going through because they're going through similar things. And so there can be some peace and support in that. So for some people, support groups are super helpful. Having said that, we know a lot of people don't have time for support groups, right? Like your carers, your time is limited. So finding that support groups can sometimes be hard. Other people will decide that maybe they need some counseling just to have a one-on-one place where they can talk about ways to cope, manage day-to-day stressors, just process through what's going on with them. In just their situation. So sometimes finding a therapist and getting some counseling can be a really good thing. Either while all of this is going on, I find that more carers probably say after treatments or when things have leveled out a little bit is when they feel like they have time to process and to do those things for themselves. But it's always something to think about. Next. Okay, so where do you find support? So I'm going to go over the Leukemia and Lymphoma Society. I'm going to go over some of our resources that are accessible online anywhere. But also there's the No AML Global Network for patients who are dealing with AML. And then of course the Acute Leukemia Advocate Network membership. So those web pages have great list of organizations all across the world that have supports and resources and information for blood cancer patients. So I know when I have an international call or chat, I am absolutely hopping on there to figure out, is there an organization in their country that I might be able to refer them to for supports and resources. So absolutely use those websites, both for their disease and treatment information, but also to find local potential organizations for your area. Okay. All right, so one of my favorite options of support are our online chats. And so an online chat works just like a support group. It is facilitated by a social worker, but it's done via typing instead of voice or camera. So you can do it from a smartphone, you can do it from your laptop or your, any device. And we have a whole host of online chats. We have one for caregivers that happens every week. And you'll find a lot of people on there just providing and getting support. So that's a unique way to get some support, and you can do that from anywhere. Next. Okay, another one of our online platforms is our LLS community. And so that runs much like what you think of as a discussion board. So patients, caregivers can get on, there's different groups of different diagnosis, et cetera. And you can ask questions, answer questions. You can really just see what people are talking about. So it's another way to get support. And we do post like information and treatment information and different opportunities that exist. So those are another way that you can get online and reach kind of the blood cancer community and other patients who are dealing with things and other caregivers. Next. Podcast. So LLS has a very robust podcast library. And so there's all different kinds of subjects, and some's diagnosis and some's emotional and some for caregivers. And so definitely worth looking into if you're looking for some support and maybe just other people's experiences or other information. Most of our podcasts are in English. We do have a few that are also in Spanish. Next. Okay, back to ways to cope. I'm a social worker, so self-care is something I talk about all the time, right? Like we have to take care of ourselves. So I had to put this slide up because I think as caregivers and as carers, you typically put yourself last, right? Like you have to take care of the patient. If you have other family members, if you have household things, like you seem to come last. And so this is just your friendly reminder that sometimes you have to put yourself first, even if it's just for 15 minutes, just to give yourself a breather and a break. And I talk to caregivers sometimes who are like, the things that I used to enjoy doing, I don't have time for anymore, or it just isn't as enjoyable to me just because of the different stressors. So I always say if your old ways of like taking some self-care aren't working for you, look for new ways. Do something different. Try journaling, try meditation, try crossword puzzles. It just it distracts your brain, right? So think of maybe some different ways to give yourself just a little bit of relaxation and a little bit of me time. Because we find that if you do burn yourself out, you're not as good for your loved one, right? So that's my social work plug for some self-care. Okay. So I really wanted to focus on our caregiver workbook for a moment. So in the US, we have this great workbook that we can send to our caregivers. But we also have it available as PDFs on our website. So it's accessible and downloadable from anywhere. So if you go to the next slide, Samantha. So here's just kind of an overview of what's in the caregiver workbook. lots of good information, things to think about, ways to look at things, just all kinds of good information from just an introduction of being a caregiver, communicating. So learning to communicate with the healthcare providers can sometimes be a learning curve. So there's some good information in there, some general blood cancer information, general treatment information, some good side effect, and some self-care and kind of information for you as well, how to take care of yourself. And what does the end of that caregiver role look like? So that's some of the chapters that are in there. All are available to download one chapter at a time, so you can pick and choose the things that you think might be most useful to you. And then if you go to the next slide, there are fantastic worksheets that are there. Emergency room, daily medication log, questions for caregivers to ask, appointment stuff to help keep all of your stuff organized. I mean, just all kinds of stuff on there. And we get calls from caregivers asking for more of the worksheets. Like they want more of the worksheets because, you know, something that is in there is super helpful to them. So definitely look at those, download ones that you think might be useful. So again, it's accessible on our website, on our PDF. It's listed under information booklets is where you will find those resources. Next. Speaking of booklets, so one of the big things from the survey was, you know, people were going online looking for information, right? You're looking for disease and treatment information. So the LLS has a robust amount of materials, education booklets on anything from the varying blood cancers to different, like there's a CAR T fact sheet, some side effect management, dealing with low counts, dealing with infection. You can see the low appetite and weight loss. So there's a lot of education materials. And one of the responses too was that people didn't understand the labs to try to understand that. So we have a book called Understanding Lab and Imaging Tests. We also have a booklet called Understanding Clinical Trials to help understand how those operate. So there is just a wealth of information on the LLS website under information booklets. So if you're looking for disease and treatment information, that's absolutely a good place to go. Obviously, it's information based on the US, but a lot of it is the same across the board. And then as well as using the Acute Leukemia Advocate Network and Know AML if you're an AML patient and caregiver, that there's good information on those websites as well, and also can lead to, you know, the memberships and the networks to see what's the information available in your country. And that's my reference, which was our caregiver workbook. And I think that's all I have.
So hello everyone, thank you, Stacy. So I will probably like say kind of similar things to that what you said. I will try to do it in a different way by sharing a bit like more personal stuff and on my experience. So I'm Maureen. Nice to meet you all. I've been a caregiver for my little brother. So basically, the fight started 1.5 years ago now, so it's pretty recent. He was 28. He has been like diagnosed with AML. So in January 2022. And the idea is that like he had a very specific type of leukemia and with like TP53 mutation, which was like a pretty rare. At that point, we didn't know that it was so specific. I wanted to be here with you because like to me at that point, I didn't know leukemia and lymphoma society. So I'm based in France. So also it's like we do not have as strong as like association in France, unfortunately. But like the idea is that we have been through 1 year of fight. I experienced what like Stacy was mentioning. So I've been like here for my little brother. My parents were as well. We decided like to move to the city where he was hospitalized, like to bring meals every day to him, etc. Unfortunately, like our story ended sadly because like I've lost him a few months ago. But the reason why I wanted to be here, it's because like I would have loved, I think at that point, to discuss with more like older caregivers when I was in this situation. And like I put two quotes. So to me, it was kind of like what like it's those two quotes like really resonate the way I was feeling at that point. I think like so even the darkness night will end and the sun will rises again. I think it's important to always like live like a day after a day, and always think that each day it's going to be different. And like to me, it really helped me on being on a daily like experiencing each day differently. Actually, the second quote is from Stephen Hawking, but it has been also told to us by a physician. Where there is a life, there is always a hope, and I think this we kept having it every day, and I think it's important to have it also in mind. On the next slide, I tried to put like the way so to me this was more like to say the way you feel is normal, and as Stacy said, it can be super reassuring also to know that other caregivers are experiencing the same, and that you are not alone. We already mentioned like loneliness, that of course you feel less super helpless, like you can be stressed, etc. I think one that we didn't mention that much is also guilty. Of course, you feel guilty about like not being like the patient. I know that my parents experienced even more like this feeling of being guilty. So this is those words and those feelings are not like to like remind you how you feel, but more to so that you know that this is normal. And it's important also to know that you have that other people are experiencing the same. What caregivers should know. So a lot of stuff have already been mentioned, but so basically, so sorry, I think you need to click again on the slide probably. And yes, perfect. So to me, it was like kind of my own path, and I put some ideas for you. So now I know that I didn't do all of this, but if I was going to redo the same, and I hope it won't happen, I would have done this way. So first, even as caregiver, you need to understand the disease. To me, it was a key, and we didn't have enough information at the hospital and from the physician. But we talk and we kind of forced talking to physicians. So we can't force people, but like one thing that was working for us was to email physicians, for instance, and not always like doing hoping for a meeting and do like a face-to-face interaction, etc. Like this works, but most of the time you are a bit stressed and you just forget what you wanted to ask, etc. So if you have questions on the disease, list them and talk to the physicians, like either by phone or even by email. For us, it has been quite key in the path of caregivers that we had. Be surrounded by a family member. Of course, it can be pretty normal, but we kind of tend to isolate ourselves, even if we know that the family is here to help. So don't forget your family members and friends. I didn't mention friends, but it's also super important. Contact patient associations. So on our side, to be honest, we didn't have any patient association like around us. If you are in this call, it's because you know Alan, so I guess it's a good start for you. But like contact, do not hesitate to contact them because it can really help in the fight. Go on pertinent leukemia websites because like I've been among those ones like going through internet and like on shitty websites sometimes. Like try to find the right sources. Stacy gave you like a list of resources and go to them and I think it's gonna be key. Don't read scientific articles. I know that it can be a bit painful and you're kind of, I won't understand anything, blah blah blah. First you can get helped to read those articles, and it can also give you a better idea of the disease. Understand existing treatment options. So it's a bit linked to the first one, but caregivers are not that involved in the treatment options. It's at least in France, and it seems to be the same in the US, but it's it can be frustrating because it's like physician-patient relationship, which is stronger than caregivers-physician. But again, do not hesitate to list questions you have for the physicians, to take notes while you are in meeting with them. And another thing that I put, and I think is super important, we didn't do it, and we could have done it, is asking for a second opinion. It's not super usual in France. Like a lot of people do not do it, but at least you have this option, and it can be super important for the patient and for the caregivers. No, you are not alone. So I think especially with leukemia, you are very isolated in a way, because patients are isolated because of the form of blood, because it's a blood cancer, and you do not see a lot of other caregivers, or you do not see anyone when you go in the corridor of the hospital. So you need to go elsewhere, or to have not to be alone. I already mentioned it, but stay close with your family. Get support from a social care professional and psychologist. It helps a lot. Most of hospitals has their own one in the service, and it's really key. And another thing I wanted to add is, even if it's not the moment, do not hesitate to discuss with other caregivers, like in the room where you put your clothes, etc. Most of the time I was a bit reluctant, but each time I did it, it was like I was like in a it was a safe place to discuss, and I think it's key as well. And join caregivers groups on social media because it can also help. For the first one, and I hope you won't necessarily go to this first step, but so if you have to hunt for a new treatment option, you can, of course, ask your physician to help you with, so we mentioned a lot clinical trials. On our side, we kind of knew what it was, but it was super blurry. So ask your physician what it is exactly. So it's really like drugs that are in development, and you have criteria to enter a clinical trial. On our side, we kind of didn't know what it was. So ask your physician to help you on that. And another option is compassionate use. What does it mean? It's really like when you can't enter a clinical trial, you can ask your physician to ask for compassionate use of a drug. It's not easy to have, but it's an option that caregivers should know and that patients should know, because it's not something that is mentioned a lot, unfortunately. You can also contact external tools. So I mentioned few that on my side we contacted and that helped a lot. So I have kind of 10 of them. I put the ones that were the most useful for us. So basically those tools are ready to help patients and caregivers to find new treatment options when physicians do not have for the patients. Just few words on a few takeaways to end the testimonial. And sorry, I've been a bit long, I guess. We are not trained to be a caregiver. So this is kind of a first training for you, but be kind to yourself. Like you can't really know how you're gonna react like every day. Every day is a different day of fight, and it's what I mentioned at the beginning. And I would recommend, and again, it's like super personal, but like kind of find the right balance between being supportive and being honest about your emotions. Most of the time, like caregivers feel a lot of pressure because they want to be positive all the time. It's not possible to be positive all the time. So it's also okay, even with your loved ones, to show your emotions with them. And take time for yourself. Stacey already mentioned like a list of pretty good ideas. On my side, meditation was working pretty well, and do not forget to sleep a lot. Thank you. And I will let Gretchen speaking, I guess.
Okay. Hi, I'm Gretchen Flato, and I live in Austin, Texas. And what you're seeing in this picture is a picture of my husband. Our experience was quite some time ago. So he was about, I think, 31 when he was diagnosed with AML. And as you can see in the picture, we had two small children. We had when he was first diagnosed, we had a 2-year-old. Hannah was 2 and Matthew was 4. In this picture, they're 3 and 5. When he was diagnosed, we had, it was definitely kind of what you saw on the slides. We were totally shocked. He was playing rugby. He got hit, had a horrible black eye that we thought was really weird, went to the doctor, and pretty much by the end of the day, we're checking into the hospital. and being told that he had leukemia. And, you know, for me as a caregiver, I really had to figure out how to take care of both him and my 2 children. And, you know, that was definitely a huge challenge. The initial treatment was about, most intense part was about a month to 2 months initially, and he did pretty well. I mean, he, you know, once he got out of the hospital, started to recover, but then about 10 months later, Art had relapsed, and at that point, we were told that he needed a bone marrow transplant. So that got even more complicated because we, in Austin, Texas, and I think it's still true, we couldn't do bone marrow transplants here, so we had to relocate to another city. And I think what actually helped me survive it and helped Art survive was, especially the second time around, I found that for me to make it as a caregiver, I needed some control in the situation. So I think I really found my voice by that point. I asked a lot of questions, and if I didn't like the answer, I kind of pushed back. I mean, that to me, that was one of the most important parts of the experience, was to not always accept what they told us. So, and I think, you know, for things like the first time around, it was very upsetting for the kids. We had family support and friends, but our whole schedule, everything was different and confusing, and my kids were kind of freaking out. One of the things that I asked for, you know, they kept wanting to put him back in the hospital, and I pushed back and said, what can we do at home? And I remember the doctor kind of saying, well, nobody's ever asked me that before, but maybe that could be done. And we actually did quite a bit of his treatment at home, and that was fairly unusual at that time. This was about, like I said, 30 years ago. But it was so much easier. It made my life easier as a caregiver. I don't know if it was necessarily the best for Art, but I knew that it helped me. I could manage him and the kids when we were at home much easier than if I was at the hospital and somebody else was with the children. I think, you know, so for me, kind of surviving this was having some control in these situations, and pushing back if we didn't feel like we were getting the right answer. There were times that we went and got second opinions. It never changed, actually, what we did. We found out from that, though, that the doctor we were dealing with really was at the top of his game, but that we had that assurance that really helped. I think, you know, the other piece for me was just kind of figuring out a new normal, because, you know, like I said, everything was very different. It was a very intense treatment, and it was helpful to kind of just put aside that this isn't the way things used to be, and just kind of figure out, okay, what's our normal now, and how do we do that? But and how do we make that work? I think that in terms of support, for us, family was really important. We had a fairly large family. Most of them did not live in Austin, Texas, but everybody took a week off and would come and be there and help us out. And that was incredibly helpful. We had friends that were really helpful. And, you know, I think that I have never been good at asking for help. Fortunately, a lot of people just said, I'm here and this is what I can do. And, you know, I definitely had to learn to ask for help. I remember one time, my mother-in-law was with us and helping out, and somebody came to the door, and I overheard this conversation, and they offered some kind of help. I think they were offering dinner or something. And my mother-in-law immediately said, oh, no, we don't need help. And after that, I mean, I actually kind of interrupted her, and I said, no, we can use help, and thank you, and we really appreciate it. And I had to kind of teach her that too, that being strong and not accepting help that's offered really was not you weren't going to get to the right place. If we can advance to the next picture. So Art survived. And in this picture, you'll see Art's on the right, and my son Matthew in this picture is probably about close to the age that Art was when he was diagnosed. And then the other person in the picture is Ralph, who is Art's brother, and he was his bone marrow donor, and part of the reason that, or a lot of the reason that Art survived. But So Art survived. I'm pretty sure that, this was the Scenic Shores ride, and we were raising money for the Leukemia Society in this ride. But so he now does 100-mile rides, even though he's definitely had some after effects from the treatment. He's actually probably healthier than most people his age. And I want to stop there just to allow time for questions.
Thank you so much. So I'm going to stop sharing because otherwise I do not see anything. Okay. Are there any questions? You can still type the questions in the chat. I don't see any questions. Okay, yeah. So in any case, if some questions comes to your mind, you can always email Stacy or myself, and then we would direct the questions to whoever should or could answer the question. Questions. Let's see. Okay, so thank you for sharing, and thanks. Okay, so thank you for being with us. Really, Gretchen and Marin, thank you so much for sharing probably what is definitely not the best time of your life. And so thank you for sharing this difficult moment with us. And thank you also for the messages of hope and all the advice that you gave to other people. I think it's very, very important. Thank you, Stacy, as well, for being with us and sharing the amazing work that LLS is doing. So as I mentioned at the beginning, the recording and the slides will be made available on all ALAN platforms and probably LLS as well. You can contact us if you have any questions. So I'm just monitor. I think there are still.
Looks like there's one. Is there a program to improve communication between caregivers and doctors? I know from LLS's perspective, in the caregiver guide, there's a whole part of the caregiver guide that's communicating with your healthcare professional. So there's some good information and tips and tricks on that PDF that you could definitely look at.
Mm-hmm. So I think a very important message from Stacy: use what's available. LLS is doing a lot of work. There are a lot of resources available. So really just take what you need from them. You don't need to, I'm talking to patient advocates here, you don't need to replicate necessarily what others are doing. You can use what others are doing. So if no more questions, and I will bring the webinar to a close. I don't know if Gretchen, Stacy, Marin, you still want to say something before we end?
Thank you.
Yes.
Thank you all for joining us. And it's a tough time, but you can get through it.
Thank you. Okay, so have a good day, evening to everyone, and speak soon. See you soon. Bye-bye.
Thank you. Bye.
Thank you. Bye-bye.